That blood pressure number you've been feeling proud of or terrified of may not mean what you think it means. And if you're over 60, this becomes one of the most important health truths you'll ever hear. Because the most dangerous mistake older adults make is believing there is one perfect blood pressure that fits everyone. There isn't. For one senior, 122/78 can be a beautiful, protective number. For another, the exact same reading can mean dizziness, weakness, falls, kidney strain, and a body being pushed lower than it can safely tolerate. And that is why so many older adults are walking around either falsely reassured or needlessly frightened by numbers that were never interpreted in the right context. I'm Dr. William Elliott, and today I need to clear up one of the biggest myths in senior health. Before we start, please subscribe to this channel for honest senior health guidance, practical clarity, and life-saving truths every week. Because what we're talking about today is not just a number on a screen. It is stroke risk, heart attack risk, kidney health, memory health, fall risk, and your ability to wake up feeling steady and clear instead of lightheaded and exhausted. By the end of this video, you'll know what blood pressure range is generally best for many older adults, when lower is truly better, when lower becomes dangerous, and how to tell which category you may actually be in. Now here's the truth most people never hear clearly. The best blood pressure for older adults is not simply the lowest number possible. That advice sounds smart, it sounds aggressive, it sounds preventive, but it is incomplete, and incomplete advice can be dangerous. The real answer depends on at least 4 things: your true resting blood pressure, your age and physical resilience, how your kidneys and brain are functioning, and whether you feel well at that pressure or miserable. So if you've ever wondered why one doctor says get under 130, another says don't go too low, and a friend tells you after 70, 150 is fine, stay with me. What sounds like contradiction is actually nuance, and that nuance can protect you. And let me say something important right away. When I say doctor won't tell you, I usually don't mean your doctor is hiding something. I mean this truth is hard to explain in a rushed appointment. Most office visits are too short to unpack the difference between a diagnostic category, a treatment target, a home reading, an office reading, and a number that looks good on paper but feels awful in real life. So what often happens? A senior hears one sentence, "Your pressure is a little high," or "Your numbers look good," and fills in the rest alone. But blood pressure management in older adults should never be reduced to one sentence. It should be personalized, deliberate, and based on how your body is actually responding. Let's start with the part that is simple, because this matters. On standard blood pressure charts, normal is generally below 120/80. Elevated is 120 to 129 on the top number, with the bottom number still under 80. Stage 1 high blood pressure begins at 130 to 139 on top, or 80 to 89 on the bottom. Stage 2 begins at 140 or higher on top, or 90 or higher on the bottom. And if the reading is above 180/120, especially with symptoms like chest pain, shortness of breath, weakness, vision change, numbness, back pain, or difficulty speaking, that is not a wait-and-see moment. That is a medical emergency situation. So yes, the categories are real. But the best target for you still requires more thought, because here is where many older adults get confused. A blood pressure category is not always the same thing as your ideal treatment target. Those are related, but they are not identical. The chart tells us how the number is classified. It does not automatically tell us what number is safest for your particular body to live at every day. And that distinction becomes especially important after 60, after 70, and even more after 80. Why? Because aging changes blood vessels, changes medication tolerance, changes kidney reserve, changes balance, and changes how dangerous a sudden drop in pressure can be. So the goal is not to win a contest for the lowest reading. The goal is to reduce cardiovascular risk without pushing you into symptoms or harm. Let me show you what I mean with two very different older adults. Imagine Helen, 68 years old, active, walks every day, still gardens, sharp memory, no kidney disease, no major dizziness, and only one blood pressure medication. Her home readings, when measured correctly, are running around 136/82. For someone like Helen, getting that pressure lower, often into a range below 130/80 if she tolerates it, can be very reasonable and often beneficial. Why? Because healthier, more robust older adults can often gain meaningful protection from heart attack, stroke, and heart failure risk when blood pressure is controlled more tightly, as long as the body handles it well. For Helen, lower may indeed be better. Now picture Samuel, 84 years old. He gets up from a chair and has to pause because the room feels like it tips. He's on 4 blood pressure medications, his kidney function isn't what it used to be, and he's already had one near fall in the bathroom. His readings look beautiful on paper, 118/64, sometimes 112/60. And yet he feels drained, foggy, and unsteady. This is where blind obedience to a number becomes dangerous. For Samuel, the problem may not be uncontrolled high blood pressure. The problem may be that his body is being pushed too low for what it can safely handle. The pressure that protects one older adult can destabilize another. That is the entire point of this conversation. And this is where people need to hear a phrase that almost never gets said loudly enough. Lower is not always safer. Yes, uncontrolled high blood pressure is dangerous. It raises the long-term risk of stroke, heart disease, kidney damage, and even vascular dementia. But blood pressure that is forced too low can create a different kind of danger, especially in seniors. It can lead to dizziness when standing, fainting, falls, fatigue, brain fog, and medication side effects that quietly erode quality of life. In some older adults, especially those with stiff arteries and a wide gap between the top and bottom numbers, a very low diastolic pressure, that bottom number, can also become a warning sign that the balance is no longer ideal. That is why blood pressure management in aging requires judgment, not slogans. There's another piece almost no one explains clearly, and once you understand it, older adult blood pressure makes much more sense. The most common form of high blood pressure in older adults is something called isolated systolic hypertension. That means the top number is high, often 130 or above, while the bottom number stays under 80. Why does that happen? Because as we age, the major arteries tend to become stiffer. They lose some of their youthful elasticity. So every heartbeat creates a stronger pressure wave, and the top number rises. That is why an older adult may have a reading like 148/72. The top number is the issue. The bottom number may look fine or even low. And that's why treating older adults exactly like younger adults can become tricky. So when someone asks, what is the best blood pressure for older adults? The most honest answer is this. For many healthy older adults, especially those who are active, independent, and tolerating treatment well, aiming for a blood pressure under 130/80 is often an excellent target. But that is not the whole story. If you are over 80, frail, dizzy, on multiple medications, dealing with kidney disease, experiencing falls, or feeling weak at lower pressures, the best blood pressure for you may be more individualized and may not involve aggressively chasing very low numbers. In other words, the ideal target is the lowest pressure that reduces risk without making your body pay too high a price. That is the sentence I wish every senior heard. And I want to pause on adults over 80, because this is where the conversation becomes especially important. Some adults in their 80s are extraordinarily strong. They're walking, traveling, managing finances, exercising, thinking clearly, and tolerating treatment beautifully. For those adults, blood pressure goals can sometimes be approached very similarly to younger seniors, with close monitoring. But another 80-year-old may be dealing with frailty, reduced appetite, kidney vulnerability, balance problems, or cognitive decline. That person is not the same patient. They should not automatically be pushed toward the exact same numbers. Age matters, yes, but function matters even more. Two people can both be 82 years old and require completely different strategies. That is not inconsistency. That is good medicine. So how do you know whether your current pressure may be too high, just right, or too low for you? Start with symptoms, but don't stop there. High blood pressure is notorious because it usually causes no symptoms at all until damage has been building for years or a crisis happens. That's why it's so deceptive. You can feel completely fine with dangerous numbers. But pressure that has been pushed too low often does talk back. It may show up as lightheadedness when you stand, morning dizziness, unusual fatigue, weakness, blurred thinking, or feeling like you need to steady yourself after getting up. And older adults ignore these clues all the time because they assume it's just age. Sometimes it isn't age. Sometimes it is the blood pressure target no longer matching the body. Now, before we go 1 inch further, I need to tell you something that may completely change how you interpret your own numbers. If your technique is wrong, your target discussion becomes meaningless. You cannot decide what blood pressure is best for you if the number itself is false. And home monitoring is incredibly valuable, but only when it's done correctly. A bad home reading can frighten you, mislead your doctor, or hide a problem that actually needs treatment. So if you've been checking your blood pressure over a sweater sleeve right after climbing stairs, while talking, while stressed, or with a cuff that doesn't fit, you may not know your real baseline at all. And if you don't know your real baseline, you can't know your real target. The monitor itself matters. Use an automatic upper arm cuff monitor, not a finger monitor, and not a wrist device unless a clinician specifically tells you there is no better option. The cuff size has to fit your arm. That is not a small detail. It is a major source of error. A cuff that is too small or too large can throw the reading off and make a controlled pressure look dangerous or a dangerous pressure look acceptable. The monitor should ideally be validated, and once you buy it, bring it to a medical appointment so it can be compared with office equipment. Then bring it in again periodically, because the best monitor in the world is useless if it's drifting and no one realizes it. And the preparation matters just as much. For 30 minutes before checking your pressure, avoid caffeine, smoking, and exercise. Empty your bladder first. Sit quietly for at least 5 minutes. Don't talk. Don't use the phone. Don't cross your legs. Sit upright with back support and your feet flat on the floor. Rest your arm on a table so the cuff is at heart level. Place the cuff on bare skin, not over clothing. Then take at least 2 readings 1 minute apart and record both. A single reading is just a snapshot. A pattern is what tells the truth. The American Heart Association is very clear on this point, and it matters even more in older adults, where decisions about medication can affect balance, kidneys, and overall independence. Timing matters too. If you take your pressure at random hours after random activities, you are not tracking a trend. You are collecting noise. Blood pressure changes throughout the day. It rises and falls with activity, stress, position, meals, and natural body rhythms. So if you want numbers that mean something, measure at the same times each day, ideally under the same conditions. Morning before breakfast and medication can be useful. Evening before dinner can also be useful if your clinician recommends it. Keep a written log or a digital log. Bring dates, times, and readings to appointments. Older adults who rely on memory almost always remember the frightening numbers and forget the normal ones. And that creates treatment decisions based on fear instead of evidence. Now let's talk about something that confuses many seniors. My blood pressure is always higher at the doctor's office than it is at home. Which one is right? Often, home readings are lower, and that can be very meaningful. Some people experience what's commonly called white coat hypertension, that their pressure rises in the medical setting because of stress, rushing, pain, or anxiety. That is one reason home readings can be so valuable. But here's the catch. Home readings only help if you know they are accurate and you are using proper technique. Otherwise, you may replace one misleading number with another. The safest path is to compare your home monitor in the office, confirm the cuff size, confirm your technique, and then use repeated home readings to build the real picture over time. So what should make you worry that your blood pressure is genuinely too high? Persistent home readings in the stage 1 or stage 2 range deserve attention, especially if your top number is repeatedly above 130 or your bottom number is repeatedly above 80. And when the top number starts living in the 140s and above, especially over time, the case for treatment becomes stronger in most older adults because that's where long-term cardiovascular risk becomes harder to ignore. If readings suddenly go above 180 over 120, wait a minute, sit quietly, and recheck. If they remain that high, you need urgent medical guidance. And if that high reading comes with chest pain, shortness of breath, weakness, numbness, vision changes, back pain, or trouble speaking, call emergency services immediately. That is not routine hypertension anymore. But there is an equally important question. What should make you suspect your blood pressure is too low for you? This is the part older adults are rarely taught. Watch for repeated dizziness when standing, near fainting, unexplained fatigue, new brain fog, shakiness, weakness, or feeling unstable when you walk. Also pay attention if your home readings are regularly dropping into the low 100s on the top number or below that, and you feel worse, not better. Some adults can tolerate those readings beautifully. Others cannot. The number alone is not enough. What matters is the combination of the number and the body's response to it. This is why a medication plan should never be adjusted based only on pride over a lower reading. Feeling steady, clear, and safe matters too. And this is where medication strategy becomes more artful than people realize. Many older adults think if one medication doesn't completely fix the number, the answer is simply more medicine. But blood pressure treatment is not a race to pile on pills. Sometimes a combination of lower doses works better than one large dose. Sometimes the timing of the medication matters. Sometimes the real issue is dehydration, sleep apnea, excess salt, alcohol, anti-inflammatory pain medicines, steroid use, stress, or poor measurement technique, not a body that needs yet another prescription. Blood pressure can also be influenced by kidney disease and other medical conditions. So if the numbers are behaving strangely, don't assume the only explanation is, I need stronger medicine. First, make sure you understand the entire context surrounding those readings. And yes, lifestyle still matters, even if you already take medication. This is not empty advice. Weight, movement, salt intake, alcohol, smoking, sleep quality, and chronic stress all influence blood pressure. Older adults often underestimate how much small daily habits matter because the effect isn't always dramatic overnight. But steady walking, better sleep, less sodium, less alcohol, and a more heart-healthy eating pattern can improve blood pressure control and sometimes reduce the medication burden required to manage it. I'm not saying lifestyle replaces medication for everyone. It doesn't. I'm saying lifestyle changes can make the target easier to reach and safer to maintain. And for many seniors, the best blood pressure is achieved not by one heroic decision, but by dozens of modest, repeatable habits. Sleep especially deserves more respect in this conversation. If you're sleeping badly, waking unrefreshed, or snoring heavily, that may be part of the blood pressure story. Stress matters too, not just emotional stress, but the chronic physiological stress of pain, poor sleep, caregiving, isolation, and illness. Some people also have secondary contributors, like medications or kidney issues, driving the pressure. So if your blood pressure is suddenly changing, don't assume your body has simply gotten worse. Ask what else changed. Did a new medicine get added? Did the dose increase? Are you taking more ibuprofen? Are you less active? Are you sleeping less? Did you start feeling dizzy after the treatment got intensified? The best blood pressure target can only be found when the full picture is honestly examined. Now let me give you a practical framework. If you are roughly between 60 and 79, active, cognitively sharp, kidney function reasonably preserved, and you are not having dizziness or falls, a home blood pressure target under 130 over 80 is often a very sensible and protective place to aim. not because it looks pretty, but because for many healthier older adults, getting pressure controlled into that zone may reduce the risk of major cardiovascular events. That does not mean everyone must be driven to 120/70. It means that mildly high should not be casually ignored just because a person is older. Age does not magically make elevated blood pressure harmless. In fact, it often makes its long-term consequences more dangerous, not less. But if you are older and frailer, especially over 80, or you have multiple chronic illnesses, reduced kidney reserve, frequent dizziness, falls, memory problems, or signs that your medications are wearing you down, the conversation shifts. The question becomes, how do we control clearly dangerous pressure without over-treating you? In that situation, many clinicians individualize the target much more carefully and monitor more often rather than blindly forcing the lowest possible number. This is especially important if the bottom number is drifting very low, if your symptoms began after treatment changes, or if your quality of life is slipping while the chart looks perfect. A number is not truly good if it costs you steadiness, strength, confidence, and independence. Blood pressure control should support life, not shrink it. So if you've been told, at your age, 150 is fine, I want you to hear me carefully. That might be fine for some people in certain contexts, but it should never be used as a lazy universal rule. And if you've been told, everybody should be at 120/80 no matter what, that is also too simplistic. The truth lives between those extremes. Older adults are not one group. There are vigorous 82-year-olds who may do very well with lower targets, and there are vulnerable 72-year-olds who become symptomatic when pushed too hard. The correct target is not determined by age alone. It is determined by your physiology, your risks, your symptoms, your function, and the quality of the numbers you are basing decisions on. That is what personalization actually means. Let me answer the title directly now because you deserve a straight answer. What is the best blood pressure for older adults? For many healthy older adults, the best blood pressure is often somewhere under 130/80 when measured correctly and when it is well tolerated. That is the simple answer. But the complete answer is this. The best blood pressure for an older adult is the lowest stable pressure that reduces stroke and heart risk without causing dizziness, weakness, falls, kidney problems, or loss of function. If a lower number protects you and you feel well, wonderful. If a lower number makes you feel worse and destabilizes your life, that number may not be best for you. And that is the truth most headlines leave out. Now I want to give you 3 questions to bring to every blood pressure conversation from this day forward. Number 1, are these readings accurate, repeated, and taken correctly at home? Number 2, how do I actually feel at this pressure? Clear, steady, energetic, or dizzy, tired, and off balance? Number 3, what target fits my age, resilience, kidney function, fall risk, and medication burden? If you ask those 3 questions, you will immediately have a more intelligent discussion than most people ever have about blood pressure. Because suddenly the conversation is no longer, is 128 good? It becomes, is 128 good for me, in my body, under these conditions, with these symptoms, and with these medications? That is the right question. And if your doctor has never explained it to you this way, don't leave angry, leave informed. Bring your home log, bring your monitor, bring your symptoms, bring the exact times you feel dizzy or weak. Ask whether your pressure should be judged by home readings, office readings, or both. Ask whether your current goal is based on prevention, frailty, symptom control, kidney protection, or a previous cardiovascular event. Ask whether the dose, timing, or combination of medications might be the real issue. Ask whether standing blood pressure should be checked if you get lightheaded. Good care gets better when the patient brings better information. And when it comes to blood pressure, informed older adults can prevent years of unnecessary fear, over-medication, or under-treatment. Let me leave you with this, because I think it matters more than any single number. Blood pressure is not a grade on how healthy or disciplined you are. It is a physiological signal. It is a clue. It needs interpretation. A reading that is too high for too long can quietly damage your brain, kidneys, heart, and arteries. But a reading that is pushed too low can quietly steal your balance, confidence, and independence. The safest path is not denial, and it is not obsession. It is accurate measurement, honest symptom tracking, and a target tailored to your real life. That is how seniors stay protected without being overtreated. That is how numbers stop controlling you and start serving you. So here is your action plan starting today. First, make sure your home monitor is an upper arm device with the right cuff size. Second, measure correctly. Rested, seated, quiet, bare arm, 2 readings, same time, written log. Third, pay attention not only to the number, but to how you feel at that number. Fourth, if your readings are persistently high, take them seriously. Fifth, if your pressure is low and you're getting dizzy, weak, or unsteady, take that seriously too. Then bring all of it to your clinician and ask for a target that fits you, not just the chart. That one step can change everything, because the best blood pressure for older adults is not hidden, it's individualized. If this video helped you finally make sense of your numbers, share it with someone over 60 who needs to hear this before their next appointment. Subscribe to the channel because this is exactly the kind of truth that protects seniors from confusion, bad assumptions, and dangerous one-size-fits-all advice. Your blood pressure should not be a mystery. It should not be a scare tactic, and it should never be treated like a simple slogan. The right target can help you protect your heart, preserve your mind, prevent stroke, and keep your body steady enough to enjoy the years you worked so hard to reach. Take care of yourself, and I'll see you in the next video.